Hi, Jason here. This is the consultation section of my website, and my intention is to give you an overview about how working with me looks. So here goes. The first step is you get in touch with my care coordinator, my patient liaison, set up an appointment, and then that person will work with you to help you get all the information that I need up front. This will be lab work, pathology reports, any kind of scans that you have, surgical data, and your own health history. And you'll also fill out the forms that are available here on this website that'll help give me more information about who you are. I'll take all that information and I'll take a look at it and get an overview. Then at our scheduled appointment, we'll sit down. Hopefully you're here in person so I can see you, your skin, your eyes, take your pulse and look at your tongue and get your vital signs like blood pressure and heart rate and breathing rate and all those kind of things. It's not necessary, but it's ideal if you can be in person for the first visit. Then we'll go through a question and answer where I'll go through all of the things that I want to know about you. I'll ask you a big list of questions. Look for answers that will help inform me about your constitution, about your state of health or disease. Then we'll go through all of your lab work. We'll go through all of the medical information that you have. We'll review your health history. We'll put the whole story together and so that I have a really nice complete picture about where you are, the environment in which you live, and then the biological terrain, what's happening with the microscope, and what we've seen inside your body that way. Put it all together into a comprehensive whole, and then I build for you what I call your botanical nutritional medicine protocol. The protocol I build will come to you within a week of our initial consult, and it will have information that you'll see listed here on this page in the following areas: botanical nutritional medicines, diet and lifestyle recommendations. It will have lab work requests and any kind of testing that I want to see. It will have recommendations for future therapies and potential outcomes, potential pharmaceutical avenues to pursue with your other doctors. And it will also have a plan that will basically put all the pieces together and kind of outline what I'm seeing as far as the steps going forward, near future, distant future, and then some outcomes. So once I generate that document, I'll send it to the my medicinary, and the medicinary will go over that material and then we'll edit it and send it to you. Once you get that material, receive it, and review it, then you'll set up a consult with my care coordinator to review that with me, so that if there's any questions, if anything's unclear, we can go over it, and so make sure that everything is clear and you have a good understanding about what we're doing. Once we've done that, then you can order the materials from the medicinary. There will be individual formulas, there will be some supplements, there will be things that might be topicals, things that could be oral, etc. When you finally order that material, you'll receive it within the week. Then we'll have a second review after you've started to take the medicines. And generally that's about 2 weeks out. So once you receive the protocol, about 2 weeks out, you'll set up a consult to review how it's going with the new medicines. And that consult can be anywhere from 15 to 30 minutes depending on how things are going. And we'll review if you've had any symptoms, any changes, if you had changes in pain, if you've had changes in digestion, etc. And then we'll make some modifications to the protocol going forward. We'll also be looking forward for any information that might come in from that initial plan. That would be things like the lab reports or additional scans, some tumor genetics, etc. If we get that information in, we can also review it at that time. Then what happens from there is that you get up to speed on the full protocol and integrating all the changes that I want you to make into your life. Once that's all in place, we'll set up regular follow-up consults to review how you're doing and then make modifications to the plan. As information comes in, that will inform us about how we want it to change things or modify things. And then I'll keep reflecting with you on how your symptoms are changing, how your overall state of health and well-being is. And that's basically how the process goes for the time beyond the initial consult and all the things I just described. So that's a quick overview. A lot of information is here available for you in this consult section. If you have any more questions, feel free to contact us, and we'll be happy to give you any information that you need. I look forward to working with you in the near future. Thanks for being here.